actually working in the hospital and doing that research in the hospital, being present as someone was having a near-death experience, like the case of patient 10, I was actually there at the time he had his experience, didn't realise he was having a near-death experience until he regained consciousness 4 hours later. And he was very excited about something, trying to tell the doctors, and described this near-death experience. And everything that he described during the time when he was deeply unconscious happened, you know. He described my actions, he described the actions of the physiotherapist, he described which consultant had examined him, although he hadn't seen that doctor prior to losing consciousness that day. Everything he said was completely accurate. And further to that, this man has cerebral palsy as well, so his right hand is in a permanently contracted position like this. After his near-death experience, he can open it out fully, and physiologically that should not be possible. So I think actually doing that research, being there in the clinical environment while these experiences were happening, it was a unique experience, it was incredible. That to me is fascinating. Now, I've asked the doctors about this and I've asked the physios, and they said there's no way that could happen, Penny, no way. You'd need, because his hand would be in that permanently contracted position, the tendons would be shortened. So to open his hand out, he would have to have an operation to release the tendons. Well, that wasn't done. You know, I checked his notes to see if he'd had extensive hand physio. Nothing like that was done. And so that's the thing, if we understood that, think about how many people out there have similar ailments and who require surgery. We'd save the NHS millions of pounds every year.
Absolutely.
It's incredible. So why aren't people curious about this? Why don't people look at it?
This is the thing that we always come back to, isn't it? This knowledge that you're scratching the surface, but we're trying to make sense of it, and it comes down to why isn't this available?
That's it.
Because nobody wants healthy, happy citizens, do they? They don't. They don't want.
That's right.
You know, it doesn't make.
Can't make profit.
Don't make money out of